a WikiVidi documentaries production. Don't forget to like and subscribe. Enjoy. Autopsy. An autopsy is a highly specialized surgical procedure that consists of a thorough examination of a corpse by dissection to determine the cause and manner of death or to evaluate any disease or injury that may be present for research or educational purposes. It is usually performed by a specialized medical doctor called a pathologist. In most cases, a medical examiner or coroner can determine cause of death, and only a small portion of deaths require an autopsy. Autopsies are performed for either legal or medical purposes. For example, a forensic autopsy is carried out when the cause of death may be a criminal matter, while a clinical or academic autopsy is performed to find the medical cause of death and is used in cases of unknown or uncertain death, or for research purposes. Autopsies can be further classified into cases where external examination suffices, and those where the body is dissected and internal examination is conducted. Permission from next of kin may be required for internal autopsy in some cases. Once an internal autopsy is complete, the body is reconstituted by sewing it back together. Etymology of the word autopsy. The term autopsy derives from the ancient Greek alpha tau omicron psi alpha autopsia, to see for oneself, derived from alpha tau sigma and psi iota sigma. The word autopsy has been used since around the 17th century. It refers to the examination of inside the dead human body to discover diseases and cause of death. Purpose. The principal aim of an autopsy is to determine the cause of death, the state of health of the person before he or she died, and whether any medical diagnosis and treatment before death was appropriate. In most Western countries, the number of autopsies performed in hospitals has been decreasing every year since 1955. Critics, including pathologist and former JAMA editor George T. Lundberg, have charged that the reduction in autopsies is negatively affecting the care delivered in hospitals, because when mistakes result in death, they are often not investigated and lessons therefore remain unlearned. When a person has given permission in advance of their death, autopsies may also be carried out for the purposes of teaching or medical research. An autopsy is frequently performed in cases of sudden death, where a doctor is not able to write a death certificate, or when death is believed to result from an unnatural cause. These examinations are performed under a legal authority and do not require the consent of relatives of the deceased. The most extreme example is the examination of murder victims, especially while medical examiners are looking for signs of death or the murder method, such as bullet wounds and exit points, signs of strangulation, or traces of poison. Some religions including Judaism and Islam usually discourage the performing of autopsies on their adherents. Organizations such as Zaka in Israel and Masaskim in the United States generally guide families how to ensure that an unnecessary autopsy is not made. Autopsies are used in clinical medicine to identify medical error or a previously unnoticed condition that may endanger the living, such as infectious diseases or exposure to hazardous materials. A study that focused on myocardial infarction as a cause of death found significant errors of omission and commission, i.e., a sizable number of cases ascribed to myocardial infarctions were not MEs and a significant number of non-MEs were actually MEs. A systematic review of studies of the autopsy calculated that in about 25% of autopsies a major diagnostic error will be revealed. However, this rate has decreased over time, and the study projects that in a contemporary U.S. institution, 8.4% to 24.4% of autopsies will detect major diagnostic errors. A large meta-analysis suggested that approximately one-third of death certificates are incorrect, and that half of the autopsies performed produced findings that were not suspected before the person died. Also, it is thought that over one-fifth of unexpected findings can only be diagnosed histologically, i.e. by biopsy or autopsy, and that approximately one-quarter of unexpected findings, or 5% of all findings, are major and can similarly only be diagnosed from tissue. One study found that autopsies revealed 171 misdiagnoses, including 21 cancers, 12 strokes, 11 myocardial infarctions, 10 pulmonary emboli, and 9 endocarditis, among others. Focusing on intubated patients, one study found abdominal pathologic conditions, abscesses, bowel perforations, or infarction, were as frequent as pulmonary emboli as a cause of Class I errors. While patients with abdominal pathologic conditions generally complained of abdominal pain, results of examination of the abdomen were considered unremarkable in most patients, and the symptom was not pursued. Forensic autopsy. A forensic autopsy is used to determine the cause and manner of death. Forensic science involves the application of the sciences to answer questions of interest to the legal system. Medical examiners attempt to determine the time of death, the exact cause of death, and what, if anything, preceded the death, such as a struggle. A forensic autopsy may include obtaining biological specimens from the deceased for toxicological testing, including stomach contents. Toxicology tests may reveal the presence of one or more chemical poisons and their quantity, because post-mortem deterioration of the body, together with the gravitational pooling of bodily fluids, will necessarily alter the bodily environment. Toxicology tests may overestimate, rather than underestimate, the quantity of the suspected chemical. Following an in-depth examination of all the evidence, a medical examiner or coroner will assign one of the manners of death provided for in the fact finder's jurisdiction and will detail the evidence on the mechanism of the death. United States. In most United States jurisdictions, each death is categorized as taking place in one of 5 manners of death. Most states require the state medical examiner to complete an autopsy report, and many mandate that the autopsy be videotaped. England and Wales. Although England and Wales use the accident designation, in those jurisdictions the term applies to deaths resulting from a risk that is either a reasonable or b neither I voluntarily assumed nor 2 intentionally created by another party. For deaths resulting from deliberate assumption of unreasonable risk, England and Wales use the category misadventure. Clinical autopsy. Clinical autopsies serve 2 major purposes. They are performed to gain more insight into pathological processes and determine what factors contributed to a patient's death. Autopsies are also performed to ensure the standard of care at hospitals. Autopsies can yield insight into how patient deaths can be prevented in the future. Within the United Kingdom, clinical autopsies can be carried out only with the consent of the family of the deceased person, as opposed to a medico-legal autopsy instructed by a coroner or procurator fiscal to which the family cannot object. Over time, autopsies have not only been able to determine the cause of death, but also lead to discoveries of various diseases such as fetal alcohol syndrome, Legionnaire's disease, and even viral hepatitis. Process. The body is received at the medical examiner's office, municipal mortuary, or hospital in a body bag or evidence sheet. A new body bag is used for each body to ensure that only evidence from that body is contained within the bag. Evidence sheets are an alternative way to transport the body. An evidence sheet is a sterile sheet that covers the body when it is moved. If it is believed there may be any significant evidence on the hands, for example, gunshot residue or skin under the fingernails, a separate paper sack is put around each hand and taped shut around the wrist. There are 2 parts to the physical examination of the body: the external and internal examination. Toxicology, biochemical tests, or genetic testing/molecular autopsy often supplement these and frequently assist the pathologist in assigning the cause or causes of death. External examination. At many institutions the person responsible for handling, cleaning, and moving the body is called weiner, the German word for servant. In the UK this role is performed by an anatomical pathology technician, who will also assist the pathologist in eviscerating the body and reconstruction after the autopsy. After the body is received, it is first photographed. The examiner then notes the kind of clothes and their position on the body before they are removed. Next, any evidence such as residue, flakes of paint or other material is collected from the external surfaces of the body. Ultraviolet light may also be used to search body surfaces for any evidence not easily visible to the naked eye. Samples of hair, nails and the like are taken, and the body may also be radiographically imaged. Once the external evidence is collected, the body is removed from the bag, undressed, and any wounds present are examined. The body is then cleaned, weighed, and measured in preparation for the internal examination. The scale used to weigh the body is often designed to accommodate the cart that the body is transported on. Its weight is then deducted from the total weight shown to give the weight of the body. If not already within an autopsy room at the city, county or state morgue, the body is transported to one and placed on a table. A general description of the body as regards ethnic group, sex, age, hair color and length, eye color, and other distinguishing features is then made. A voice recorder or a standard examination form is normally used to record this information. In some countries, and more, Scotland, France, Germany, and Canada, an autopsy may comprise an external examination only. This concept is sometimes termed a view and grant. The principle behind this is that the medical records, history of the deceased, and circumstances of death have all indicators as to the cause and manner of death without the need for an internal examination. Internal examination. If not already in place, a plastic or rubber brick called a head block is placed under the shoulders of the deceased, hyperflexing the neck, making the spine arch backward while stretching and pushing the chest upward to make it easier to incise. This gives the APT, or pathologist, maximum exposure to the trunk. After this is done, the internal examination begins. The internal examination consists of inspecting the internal organs of the body by dissection for evidence of trauma or other indications of the cause of death. For the internal examination there are a number of different approaches available. There is no need for any incision to be made, which will be visible after completion of the examination when the deceased is dressed in a shroud. In all of the above cases the incision then extends all the way down to the pubic bone and avoiding, where possible, transecting any scars which may be present. Bleeding from the cuts is minimal, or non-existent, because the pull of gravity is producing the only blood pressure at this point, related directly to the complete lack of cardiac functionality. However, in certain cases there is anecdotal evidence that bleeding can be quite profuse, especially in cases of drowning. At this point, shears are used to open the chest cavity. It is also possible to utilize a simple scalpel blade. The dissector uses the tool to cut through the ribs on the costal cartilage, to allow the sternum to be removed. This is done so that the heart and lungs can be seen in situ, and that the heart, in particular the pericardial sac, is not damaged or disturbed from opening. A PM40 knife is used to remove the sternum from the soft tissue which attaches it to the mediastinum. Now the lungs and the heart are exposed. The sternum is set aside and will be eventually replaced at the end of the autopsy. At this stage the organs are exposed. Usually, the organs are removed in a systematic fashion. Making a decision as to what order the organs are to be removed will depend highly on the case in question. Organs can be removed in several ways. The first is the en masse technique of Latoul, whereby all the organs are removed as one large mass. The second is the en bloc method of The most popular in the UK is a modified version of this method, which is divided into 4 groups of organs. Although these are the 2 predominant evisceration techniques, in the UK variations on these are widespread. One method is described here. The pericardial sac is open to view the heart. Blood for chemical analysis may be removed from the inferior vena cava or the pulmonary veins. Before removing the heart, the pulmonary artery is opened in order to search for a blood clot. The heart can then be removed by cutting the inferior vena cava. The pulmonary veins, the aorta and pulmonary artery, and the superior vena cava. This method leaves the aortic arch intact, which will make things easier for the embalmer. The left lung is then easily accessible and can be removed by cutting the bronchus, artery, and vein at the hilum. The right lung can then be similarly removed. The abdominal organs can be removed one by one after first examining their relationships and vessels. Most pathologists, however, prefer the organs to be removed all in one block, using dissection of the fascia, blunt dissection, using the fingers or hands and traction. The organs are dissected out in one piece for further inspection and sampling. During autopsies of infants, this method is used almost all of the time. The various organs are examined, weighed, and tissue samples in the form of slices are taken. Even major blood vessels are cut open and inspected at this stage. Next, the stomach and intestinal contents are examined and weighed. This could be useful to find the cause and time of death, due to the natural passage of food through the bowel during digestion. The more area empty, the longer the deceased had gone without a meal before death. The body block that was used earlier to elevate the chest cavity is now used to elevate the head. To examine the brain, an incision is made from behind one ear, over the crown of the head, to a point behind the other ear. When the autopsy is completed, the incision can be neatly sewn up and is not noticed when the head is resting on a pillow in an open casket funeral. The scalp is pulled away from the skull in two flaps, with the front flap going over the face and the rear flap over the back of the neck. The skull is then cut with a circular bladed reciprocating saw to create a cap that can be pulled off, exposing the brain. The brain is then observed in situ. Then the brain's connection to the cranial nerves and spinal cord are severed, and the brain is lifted out of the skull for further examination. If the brain needs to be preserved before being inspected, it is contained in a large container of formalin for at least 2, but preferably 4 weeks. This not only preserves the brain, but also makes it firmer, allowing easier handling without corrupting the tissue. Brought to you by WikiVidi Documentaries. Would you like to know more?